Hey everyone, here to help mental health, here to help make mental health honest, enjoyable, accessible, and resourceful. And I'm Ellen. Nice to meet you. Uh, Today I'm actually doing a series about trauma. And in the first cog hack, which is a cognitive hack, it's just kind of quick snippets about topics related to mental health. Um, the first the first part I talked about trauma and just kind of an overview of trauma, what it is. When we think about trauma, um, it can be comes from come from lots of different shapes and sizes. It can come from different things that have maybe happened, like assaults or different types of. We think about institutional or intergenerational or chronic traumas, historical traumas, things that have happened to you, to your parents and to your grandparents in the past, and that you've been are aware of and had to deal with, and kind of see how other people have dealt with those types of things that are happening. So when we talk about trauma, it's kind of it can be lots of different things, and it can be very overarching in how it impacts. But some of the things that we do know is that there's evidence that when when there are traumatic events, and one of the most famous studies came out in the 90s, which was the Adverse Childhood Experiences, really or ACEs. We looked at really what happens in a person's childhood that really is going to impact then how they deal with things, how they've learned, but then how also their brain responds to things as an adult, and that really those adverse childhood experiences can set people up, again, for more things in the future. But it's not just about that. It's about, really any kind of situations that would be potentially traumatic. And so there's really a lot of evidence that, the way you think, and that the way you think and the way you're perceiving events that occur, that's kind of sets some of the relationship between events and then what kind of the kind of psychopathology or symptoms that you may have, or even potentially leading to some sort of a diagnosis. Now, I'm not here to diagnose or treat anyone. If you are needing some help, there's lots of different resources on the site. This is really more for information. But, really when we look at difficulties coping with different types of experiences, that there's a pathway in the brain that the brain hasn't really, put those things in the same place that it might put other types of memories. And that's going to cause a lot of different things and different symptoms. And we do think about, yes, PTSD, which I'm going to talk about in another video where I talk more specifically about symptoms of PTSD, but they can also cause different ways of thinking about things, different ways of not being able to regulate emotions, not being able to kind of feel like you can control emotions, or feel like they're happening too frequently or too often or too intense when they do happen, or just kind of the idea of thinking about different types of experiences as being trivialized, or not being able to really understand that this has impacted me in a negative manner, and that other people maybe don't see the impact of that. So again, when we're looking at things like having trauma, or having an environment that's not very validating, that isn't listening to you, that you don't feel like you're being heard, that can actually cause your brain to respond in different ways, which is what tends to cause then symptoms. And those symptoms can range significantly. Again, I'm not here to diagnose anyone with PTSD, but I will be talking about the symptoms of PTSD in the next part about trauma. So this is really just to kind of give you a little bit more of an overview. Thanks for listening. If there's anything else that you'd like to hear about, or anything specific that you'd like to know, please feel free to comment below. Click that subscribe. If you are looking for professional help, you can find us at www.here, which is HEAR-tohelp.com. Or if you're looking for any kind of education or anything like that, at www.chocolatebrain.org, and those resources are also below. Then you can also find us on social media, on Facebook, Twitter X, and on Instagram at Here to Help Mental Health. Thanks for listening. We'll see you online.